Hi, my name is Melissa Zach.
My name is Taylor Rizzi.
And my name is Siobhan McGonigal, and we are from William Patterson University, and we did our research with our faculty supervisor, Kristen Victorino, on school-based speech-language pathologists, perceptions on tele-assessment validity and reliability. So to start us off, the national health emergency, COVID-19, currently enforces restrictions impacting school districts and the services they provide. Alternative delivery models, such as tele-assessments, have seen an increase in usage in school districts. The knowledge and perceptions of speech-language pathologists play a vital role for school districts in determining the validity and reliability of tele-assessments. Previous research findings primarily focused on the intervention services rather than assessments via telepractice in a school setting. Given the positive feedback for intervention services via telepractice, we hypothesized similar support for tele-assessments. In order to develop a strong foundation for tele-assessments, it is necessary to collect the knowledge and the opinions of school-based SLPs, who are the ones administering and interpreting the tele-assessment results. So our survey was created using Qualtrics and distributed regionally and nationally via Facebook groups. These Facebook groups included speech-language pathology teletherapy and telepractice in school discussion, New Jersey school-based speech-language pathologists and speech-language specialists, and school-based SLP. We also distributed our survey through the NJSHA email distribution list. Participants had to be a school-based speech-language pathologist and have administered at least one tele-assessment. So overall, we had a total of 34 questions on our survey with a wide range of topics, which included prior experience with tele-assessments, the use of tele-assessments pre and post COVID-19, perceptions of tele-assessments, resources and barriers, and the overall perspective on implementation on tele-assessments. This survey took participants approximately 15 minutes to complete, and data collection occurred over a 2-month period. We had survey questions that included multiple choice, Likert scale, check all that apply, and open-ended for both qualitative and quantitative measures. So our data was analyzed through Qualtrics. We then exported that data on a Google spreadsheet, and our diagrams were completed for percentages, which included our multiple choice questions and our check all that apply questions, and the means of our Likert scale questions were generated through Excel. When we got our data from a total of 20 participants in total.
So next, we will look at our results section. We started out with the demographics of our participants, which had a wide range of experience, which ranged from either less than 5 years or to more than 20 years in the field, as well as in a school system. However, all participants were very inexperienced with their use of telepractice and tele-assessments. The next section that we looked at was COVID-related questions. So these questions looked at both pre-COVID and during COVID. So some of the topics of the questions included if they felt prepared to conduct assessments, if there was enough research to administer the assessments, if schools encouraged tele-assessments, as well as access to digital tools, if the school was supporting of tele-assessments, if there was enough resources for students, as well as enough resources for the SLPs, and if they were able to complete all tele-assessments they were required. For the section, most of participants said disagree or neutral, especially for if there was enough adequate access to resources and tools. However, what stood out for this section was for neutral and agree, which were school districts supporting the use of tele-assessments, as well as students having enough resources to take the tele-assessment as well. So next, we're going to look at table 1 of our poster, and this is about the perceptions of the SLPs on tele-assessments. In this section, we asked them questions on how they agree to a following statement. So some of the questions included if there was enough evidence to implement, if there was enough supporting research, if there's enough confidence in the range of disorders, like if they felt confident administering the assessment to them, as well as post tele-assessments, if they had an increase in confidence, if they saw an increase in focus in a child during the tele-assessments, if there was enough results to classify using the tele-assessments, if they were able to diagnose as well, if it was sufficient to monitor therapy progress, and if they could use tele-assessments to develop IEPs as well as determine eligibility, and if they believe that school will implement this tele-assessment use post-COVID. So as you can see, looking at the chart, most of the respondents also range between a 2 and 3, which was disagree and neutral for most of our answers. But what stood out the most here was that there was an increase in confidence administering tele-assessments. So as the pandemic went on, tele-assessments became more popular and they were more confident administering these assessments. So next, we will look at our table 2, and this is also part of the same section. So our research looks at the validity and reliability of tele-assessments. And as you can see by looking at our chart, most of our respondents remained neutral about their opinion. So the next step was looking at them if they disagree or agree, which as you can see, they are very split. So there's not really a definitive answer on their standing for validity and reliability of these tele-assessments.
And then next up, we take a look at table number 3. And table number 3 is focusing on the resources, accommodations, and modifications that were used during the SLP's tele-assessments. And in this question particularly, this required the participants to respond open-ended. So patterns and themes were collected when analyzing the data. All participants noted that there were resources, accommodations, and modifications that were utilized when administering the tele-assessments. Most frequently noted was the tech equipment and the parent and caregiver involvement. So these two high percentages. There were also digital versions of assessments, physical testing material, and various tech platforms that were also used, and they were all split here. Tech equipment was most commonly used were either document cameras, laptops, and Chromebooks. So those were the most common used. And then we move on to table number 4, and this table focused specifically on an overall of how likely you are to recommend the use of tele-assessments to others. So 35% voted that they were likely to recommend tele-assessments to others, and they had more of a positive view on tele-assessments. And there were an equal percentage of respondents between the highly unlikely and the unlikely responses. And that was kind of an overall opinion of tele-assessments. And then we move on to, there were also prominent barriers that were noted, and those were things such as internet connection, child attention, and tech difficulties. Parental interruptions were an environmental factor that also played into the environmental role.
So moving on to our discussion, overall, in-person assessments were preferred in comparison to tele-assessments. Although 35% of participants would recommend tele-assessments, their experiences with this mode of service delivery indicates otherwise. Most of our respondents rated unlikely or highly unlikely to recommend, which was approximately 50%. So most respondents did have a negative outlook when it came down to overall thoughts on tele-assessments. This was due to barriers impacting tele-assessments and a lot of questioning on the validity and the reliability due to it not being standardized. We found that a lot of our participants noted that their use of teleassessments was strictly COVID related, and also certain assessments were easier to conduct. So we saw that a lot of articulation and language assessments were used more frequently than assessments for voice and fluency. This could be due to technological issues. So if there's any tech issues with the quality, it might be difficult to perceptually judge a person's voice. As stated earlier, we had hypothesized a positive outlook towards the validity and reliability of teleassessments. However, results of this research indicated otherwise. We did have a small sample size with only 20 participants, so a larger sample size could have provided us with a better foundation on the validity and reliability of teleassessments.
And then moving on to the future research in the field, it can expand on the overall usage of teleassessments post-COVID-19. It could look further into district policies regarding future use of online platforms to deliver therapy and assessments. We wonder, will there be more resources for SLPs in the field? We can consider the amount of modifications that are made during the administration of teleassessments and whether that has an impact on the standardization, validity, and overall reliability of the assessments. And as the format of teleassessments are relatively new to the field of speech-language pathology, norm reference data is not abundant and should further be examined.
That concludes the results of our research study. We want to thank you for your time, for listening to our presentation, and thank you, NJSHA, for giving us the opportunity to present our research findings.